Good morning everyone. Today we are going to talk about the tuberculosis, which is an infectious disease caused by the Mycobacterium tuberculosis. So we can call it MTB. So today we are not going to focus on the pathology of this TB, but we are actually going to discuss about the basic drugs used for the treatment of MTB. So first of all, tuberculosis affects the lungs, but as you can see in the picture, but it can also affect the other parts of the body, such as the kidney, spine, and the brain. And if not treated properly, it can be fatal. It was once the leading cause of death in the United States, but now it is cured in the United States, and it is still common in developing countries like in Asia, we can say. So as you all know that it is an infectious disease, so it is spread from one person to another through tiny droplets released into the air through cough and sneezes. And signs and symptoms include some coughing that usually lasts up to 3 weeks, and coughing up with blood, chest pain, or fatigue, fever, night sweats. As you all know, these are so for TB, people who are at risk, they have usually a weakened immune system. For example, in HIV, diabetes, or severe kidney diseases, certain cancers, or a chemotherapy. As you all know, in chemotherapy, immune system gets down, and the advanced age. So basically, I think that was the only thing that we needed to discuss about, or we needed to know about the tuberculosis. Now we will move on to the drugs, the basic drugs essential for the treatment of tuberculosis. So let's get started. So first, I'll tell you that WHO has given us 3 basic concepts for the treatment of tuberculosis. First is that we should use multiple antibiotics so that there is no chance for bacterial survival. Second thing is we have to give the drugs regularly, and this means that in front of the healthcare professionals, so that they know that the patient is taking these drugs on a regular basis. And the third point is that we need to continue the therapy for a longer period of time, that is from 6 to 9 months, so that there is no chance of the drugs revival. For the anti-tubercular drugs, we have kind of 2 therapies, that is the first line therapy and the second line therapy. For first line, we have some drugs which have high efficacy and low toxicity. But for the second line, we have the drugs which have either low toxicity, either low efficacy, or high toxicity, or even both. So first line drugs include the HRZE, which is isoniazid. Its full form is isonicotinic acid hydroside. And we have rifamycin, pyrazinamide, and ethambutol. So the short abbreviation form for this is HRCE. In second line drugs, we have got many drugs, for example macrolides, ethionamides, and para-aminosalicylic acid, and much more. So we won't get into details for these, but today we are only going to discuss about the isoniazid, which is the basic essential anti-tubercular drug until or unless it is not tolerated by the patient, or the bacilli has developed resistance to it. So first of all, although it is the best drug, isoniazid, isonicotinic acid hydroside, which is denoted by H, but the only problem we have to face with this is that it cannot kill the bacteria in quiescent stage, for example the resting bacteria. Second point is it cannot kill the non-tubercular bacterium. So basically it kills all the fast multiplying bacteria, but unable to kill the bacteria which is at resting stage. It can kill both extracellular and intracellular bacteria. It is as active in acidic or basic environment. So this states that it is one of the best drugs we can use in this treatment. Now we will move on to the mechanism of action for the isoniazid. So for this, Mycobacterium is different from other cells because it has the mycolic acid cell wall. So isoniazid, what it does is that it inhibits the mycolic acid synthesis, which leads to the death of this bacteria. So what would be the mechanism for this? It is that first of all, isoniazid is not active. It gets activated by the enzyme produced by the bacterium itself. So once first of all we give the dose for isoniazid orally, it is preferred to give it orally, and the patient is advised not to take antacids or high fatty meals that will inhibit the reaction, or it will decrease the effect of the isoniazid. So for this, once we give the dosage for isoniazid, I can call it INH, it enters and is activated by the enzyme produced by the bacteria itself, which is CAT-G. It makes it active. Then this activated INH inhibits the Cas-A synthetase and INHA, which is the reductase. When these two enzymes are blocked, mycolic acid synthesis is also blocked. So in this way it forms complexes, and which leads to the death of the bacterium. So the thing is that we should also know that how this drug, how the bacteria develops resistance to this is that when we take INH, so the chromosomal, the enzyme which converts INH from its inactive form to its active form, which was CAT-G. So if you imagine that CAT-G is mutated, chromosomal mutation takes place for this catalase peroxidase CAT-G, then how the INH will be converted into its active form. So the first point is, if chromosomal mutation of catalase peroxidase CAT-G takes place, then we can say that the bacteria has developed resistance to this drug. And for its distribution, we know that it can distribute to every part of the body, because it is water soluble and it does not need to bind with any protein. And for the metabolism, we have the N-acetylation and hydrolysis. So it is metabolized by the liver, but its half-life depends on the person's genetics. For example, if a person is with the fast acetylation, then the half-life would be 90 minutes, but if it is from slow acetylation, then it would be from 3 to 4 hours. Okay, now let's move on to the adverse effect. The first adverse effect that we should remember is that it has leads to peripheral neuropathy. So in order to prevent it, we should give patients vitamin B6 and B1 supplements to prevent these peripheral neuropathy, along with isoniazid. Patients, this neuropathy is frequent in patients with low acetylation, which have longer half-life from 3 to 4 hours. This means that the drug will stay in body for longer periods of time, and people with alcohol, AIDS, malnutrition and diabetes are at risk of developing this peripheral neuropathy. The other thing we have is that they may develop hepatitis that would be due to advanced age, or if you're giving them a combination therapy. For example, we're giving them acetaminophen, this might lead to hepatitis. So you know the mechanism why we need to give the vitamin B6 to patients. It's because isoniazid promotes excretion of the pyridoxine, so we need to give the supplementation in order to avoid that deficiency. Although side effects may include the seizures, rash, fever due to the hypersensitivity reaction. So that was a quick review of the drug isoniazid we covered today. So that's it. I hope that was not a proper discussion, but I hope it was helpful, and thanks for watching. See you in the next video with the new drug. Goodbye.